Did you know there's a fungus living in the soil all around us that most of us will probably breathe in at some point? Now, for the vast majority, it's totally harmless, but for some, it can lead to a pretty serious lung infection called histoplasmosis. In this explainer, we're going to break down exactly what it is, where it hides, and who really needs to be cautious.
Hey everyone, and welcome to MediByte. We're your source for clear, reliable health information, where our whole goal is to make the complicated stuff simple. So let's jump right in.
All right, I've got a question for you. What do chicken coops, old buildings, and caves all have in common? It sounds like the start of a weird joke, right? Well, the answer is actually that they are all potential homes for the fungus that causes histoplasmosis. Let's explore that surprising connection.
So here's our roadmap for today. We'll start with what this infection actually is, then we'll explore where the fungus lives. We'll pinpoint who is most at risk, break down the 3 different ways the disease can show up, and finally, we'll cover how it's diagnosed and treated.
First up, let's get right to it. What exactly are we talking about when we say histoplasmosis? Okay, so at its core, histoplasmosis is an infection, and it's caused by a fungus called Histoplasma capsulatum. You get it by inhaling these tiny, microscopic fungal spores from the air. The infection usually starts in the lungs, but, and this is key, in more serious cases, it can spread to other parts of your body.
The way you get infected is surprisingly straightforward. It's really just a 3-step process. First, the fungus is just out there, growing in the soil, especially soil that's been enriched with bird or bat droppings. Then, something comes along and disturbs that soil. Think of a construction project, or even just cleaning out an old shed. That disturbance kicks the spores up into the air. And the final step, you simply breathe them in.
So if it's in the soil, you're probably wondering, where in the world is this a concern? Let's take a look at the global hotspots and the specific environments you should know about.
You know, while this fungus is found all over the world, it definitely has its favorite spots. Here in the US, the Ohio and Mississippi River valleys are major hotspots, but it's also really common in parts of Central and South America, Africa, Asia, and Australia. It basically just loves those moist, temperate climates.
And the fungus isn't just in any soil. It really thrives in soil that's full of bird or bat droppings. This is why places like chicken coops, caves, even the dusty areas under bridges can be high risk. And of course, construction and demolition sites are huge sources because they kick up enormous amounts of this contaminated soil into the air we breathe.
Now, here is the really good news. Most people who inhale these spores never actually get sick. So let's focus on what makes someone more vulnerable to developing the actual disease.
The risk of developing a severe infection really comes down to 2 big things: the state of your immune system and the number of spores you inhale. People with weakened immune systems, maybe from advanced HIV or because they take immunosuppressant drugs for an organ transplant, they're at the highest risk. Age also plays a role, with infants under 1 and adults over 55 being a bit more vulnerable. And of course, your job matters. Farmers, cavers, and construction workers just have a higher likelihood of being exposed.
This brings us to a really critical part of this whole topic. You see, histoplasmosis isn't just one single disease. It actually presents in 3 main forms, and they range from very mild to potentially life-threatening.
Let's break down these 3 forms. First, there's acute pulmonary histoplasmosis. This is the most common type. It stays in the lungs and usually affects healthy people. Then you have progressive disseminated. This is the most serious form, where the fungus spreads all through the body, and it typically hits people with weakened immunity. And finally, there's chronic cavitary, which also affects the lungs, but it creates these empty spaces or cavities, and it's usually found in people who already have some kind of lung issue.
So let's look a little closer at that acute form. If you do get symptoms, they usually show up between 3 and 17 days after you were exposed. And honestly, it often just feels like the flu. You might have a fever, a cough, just feel generally unwell. For most healthy people, this just goes away on its own in a couple weeks. The only exception is if you inhale a massive number of spores, which can lead to more severe pneumonia.
Now for that disseminated form, where the infection doesn't just stay in the lungs. The symptoms here are much more widespread and can be vague at first, things like weakness, fatigue, and weight loss, but as it progresses, it can cause organs like your liver and spleen to get bigger, you can get sores in your mouth, and in rare cases, it can even spread to the brain and cause meningitis. This form is very serious and needs immediate medical attention. The chronic cavitary form is more of a slow burn. It develops gradually over weeks, causing a cough and shortness of breath that just keeps getting worse. It's often accompanied by weight loss and night sweats. Over time,
The fungus causes long-term destruction, leading to permanent scarring and damage inside the lungs.
So after hearing about all those symptoms, you're probably wondering, how do doctors figure this out, and what can actually be done about it? Let's turn to diagnosis and the available treatments.
Confirming a diagnosis usually involves a few steps. First, doctors will collect samples, like blood or urine. These get sent to a lab to either try and grow the fungus in a culture or to perform what's called an antigen test. An antigen is basically a tiny protein marker that the fungus sheds, so it's a great clue. And finally, doctors will use imaging, like a chest X-ray or a CT scan, to get a clear picture of what's going on in the lungs.
Treatment really depends on the severity. For a mild, acute infection in a healthy person, a lot of the time no treatment is needed at all. The body's immune system just handles it. If medication is required, it's usually an oral antifungal pill. But for severe or disseminated cases, the approach is much more aggressive. That usually starts with a powerful intravenous antifungal medication, followed by a long course of those oral pills.
So, if there is one crucial point to take away from all of this, it's this. Despite the serious potential of this fungus, for most people with a healthy immune system, histoplasmosis is basically a non-issue. It's often so mild you would never even know you had it.
This leaves us with a final thought. This fungus is relatively common in the environment, yet severe disease from it is actually quite rare. What does that tell us? Well, it's a powerful reminder of just how incredibly effective our immune system is at protecting us day in and day out from all the invisible threats that are all around us.
And that's our explainer on histoplasmosis. If you found this information clear and helpful, please give us a like, share it with someone who might be interested, and of course, subscribe to MediByte for more deep dives into important health topics. Thanks for watching.